Thanks very much for our two chairmen, and thank you to Philip and for Juliana and Michael for inviting me to this presentation. And so far, I've learned a lot. I think you've all learned a lot, right? The one thing that I learned is that we all want to be Juliana, okay? That's the first thing that we learned. And the second thing that we learned is we don't want to be Adrian, okay? So that's the two things that we've learned. So I think good learnings all around. Anyway, so my role is to talk about fitting sort of local resources to the and system kind of things, right? And I thought, this is a huge topic, and how am I going to cover this huge topic? Because if I miss out on one country that's doing something good or something bad, people will complain. So instead of doing that, I'm going to take you on a little different journey, and I'm hoping that if this works, we may improve how we do things, okay? So bear with me. These are my disclosures. Nothing really applies to this, but I just list all the people that I've ever worked with so that you can't say that I didn't tell you that I worked with all these people. So I thought I'd start off with one funny. So this is Joe Biden, and he's saying, I've been trying to call you all day, okay, to President Obama. President Obama says, Joe, that's your calculator, okay? So there's a problem with this. So we need to use our tools wisely. And so that's really what we're going to talk about, is how do we use our tools? In other words, we want to have, let's say, the JADE program, but maybe we don't have the JADE program, but what can we do with our current programs that we have? That's what I'm going to end up with at the very end. And so if you look around the world, there are a lot of good places doing great things, but there's also a lot of places that are not doing great things. So how do we get that around? And what is the minimum information that we need to get for our patients to do well? So if we were to look at everywhere around the world, we have lots of different programs. And if you do a literature search, there's lots of programs. And a lot of them just end up saying use an EMR. In other words, just get the information digital. And once you get it digital, then everything will fix itself. I'm going to be here telling you that getting everything digital doesn't fix itself. And so therefore, that's not the goal. The goal is to make sure that patients are looked after. So if we were to start off with this, some people are paper-based. So this is our immunization record in Canada, paper-based. We just mark it all in, and then the patients carry it with them, and that's how we get the information passed on from one doctor to another to see what vaccinations have done. Some, as you've heard in India, they've got apps that you can go punch in, and so therefore you can have risk assessments, kidney function, kidney failure equations, and those kinds of things. And then, of course, we have the fancy stuff like Juliana, where there's computers and everything else, and they're pulling out great data from these areas. So we have all of those things. And our assumption always is that if we head in that direction, everything will be good. So therefore, the countries that don't have a lot of resources always felt that they'll never get to that top tier, so therefore their patients are going to suffer. And I'm here to tell you that's not true. And how are we going to get around that situation? Because not everybody's going to go digital anytime soon. So we can't wait for that to be able to save our patients' kidneys in that sense. So I thought I'd start off with this. You know, here's President Obama. Okay, this is when he's young. This was before he became president, a good-looking guy, right? And then after he had to deal with the White House and Trump and all that stuff, he became old-looking man, okay? So horrible-looking man. So let's look at this in this situation. So here's the course of any disease. So you start off with healthy kidneys, and then you end up dying from it, unfortunately. So at some point, you get flagged as being CKD. At that point, it's secondary prevention. We're trying to prevent you from progressing. And so this is where old Obama would be sitting. On the other hand, young Obama would be sitting in primary prevention, where you're trying to avoid him from having kidney failure and so on and so forth. And all this time, for the bulk of the disease, there's no symptoms at all. And that's the problem. If there were symptoms, we'd go and investigate and things like that. There's no symptoms. And so therefore, we don't know what's happening in the kidney. So that's why we have to test, we have to track these people, and then we have to treat appropriately. So that's the problem with this disease, is that the kidneys are very, very polite. I love this picture. He's only one fart away from death, okay? So definitely he's really close, right? So, and this is the problem with kidney disease, right? With coronary disease, it is also asymptomatic, but then it becomes very dramatic all of a sudden, right? So then everybody jumps in and starts doing things. But this one, the symptoms are very late, and so therefore you're going to get into the late-stage kidney disease, and therefore the outcomes are not going to be very good. So I was sitting in the woods trying to think. I said, how can we get people motivated so that they will come and detect it earlier? How do we get them to care about their kidneys? And I was thinking about other models that we can look at. And I've said, forget about diseases. We want to look outside medicine. And so look at this. This is the lineup for the iPhone 7. Okay, this is in 2016. This is the lineup, okay? So how many people had a smartphone in 2016? 3.66 billion people had a smartphone of some sort in 2016. That's 49% of the world's population had an iPhone, or a smartphone, I should say, not just an iPhone. Currently, it's 6.9 billion. And right now, our current population is 8 billion, something like that. I think it's gone up because there's been some babies in the last 2 days. But anyway, so you get the idea. And so that would be 86% of the world's population has an iPhone or smartphone of some sort. It's non-essential to life. It costs a lot of money. There's no clinical trials. There's no guideline recommendation that says you should buy one. And yet 6.9 billion people have one. So that's why when we say, oh, cost is a problem, this is a problem, this is a problem, this is a problem, it's not a problem in the smartphone industry. So how did they do it? They have a marketing funnel, okay? This is what they talk about in marketing. It's a marketing funnel. So basically, you got to grab people's attention, okay? And then what you have to do is get their interest, and then you need them to desire your product, okay? Now, I don't know how they're going to desire your kidneys, but that's the goal, okay? And then you want them to do some action. Now, in the commercial world, okay, when you're talking about Coca-Cola or iPhones or anything like that, you want them to buy something, okay? So you want to make money off of them. That's basically what you're trying to do. Can we adopt this model? Because they're very successful, okay? What's our model? In Canada, we have a website for kidney care, okay? And this is what it looks like. And so these are the wonderful things that we say. Person-centered, safe, equitable, efficiency, effective, timely. Okay, those are all very good words. Those are perfectly correct and proper words, but that's not going to get you 6.9 billion people. So we have to rethink these things, right? We got to rethink how we're doing things, because the way we're doing it right now isn't working very well. So this is Walt Disney, and he was always saying, what is the storyline? What is the story? What is the storyboard? What is the things that you're trying to get out? What's the things that you're trying to get back in? So one of the things is that, you know, these are people in Dubai, hard workers, right? They never complain. They build you these big towers. It's like 55 degrees outside, but they still work. And that's what your kidneys are like. So your kidneys they just keep working, and they never complain. So that's a message that we got to get out. Your kidneys just never complain, and they just keep working. So that's why we have to check on them. So we have to check on them because they'll never complain. They'll just keep working until they die. So that's why we have to check on them. So that's one of the good messages that we have to get out to people, okay? So if we were to forget about the purchasing funnel, and let's make this into the kidney disease prevention funnel, okay? How do we do that? So what about this awareness, okay? So how do we do that? So this is the largest funnel in the world, okay? So this is the Morning Glory Spillway, and this is a funnel that takes all that water so that it doesn't go and flood the highway, it drains it off into another basin. So there's a dam there and the water fills up. So that is the world's largest funnel in the world. So who is at risk of CKD? What's the funnel that we want to use? And so we're going to say if you have diabetes, you're part of that funnel. If you have high blood pressure, if you have heart disease, or if you have family history. We'll just start with those ones. We can throw in, you know, over age 65, those kinds of things. But we start off with a very short list, and that way we can funnel people into the system. So therefore, the awareness part is if you have any one of these things, then we want you to pay attention. And so we got to get that message out to doctors, to nurses, to lay press, to pharmacists, everybody. So if the pharmacist is filling a prescription for hypertensive medication, they got to think about their kidneys as being a funnel. Interest and desire. Here's where I thought about sex. Okay, I don't know why, but anyway, desire is sex. And that's what I was thinking in the first session when we were talking about how do you make it fun. I thought sex, but nobody mentioned sex. So definitely sex. So if you treat your diabetes well, you can continue to have sex. That would be a good program. I don't think KDIGO could actually, you know, sponsor that. So how do we get interest and desire in there? Well, look at this. If I showed you that little kitten, you want to take care of that kitten, right? You want to feed the kitten, you want to pet the kitten, you want the kitten to be good. Nothing to do with sex, so Michael, you're okay, no problem. So it's all about prevention and protecting you, okay? So in other words, it's not about finding disease. See, right now, it's about finding disease and then telling you bad news. You got to get your kidney test done because we're going to tell you you have chronic kidney disease and you're going to die or have dialysis. So it's a negative situation. So we need to flip it into a positive situation. If we can find things, we can help protect you, help prevent these things from occurring. So therefore, whether you're testing here, or here, or here, or even in when you have CKD, it's all about prevention and protecting you, as opposed to finding out that you have horrible disease. So therefore, the message is actually a hopeful message that we have to give out, okay? The iPhone never tells you you're going to be addicted to me, I'm going to give you bad vision, I'm going to cost you a lot of money. They never tell you that stuff, right? They always tell you about the good stuff. Anybody been on a cruise? Been on a cruise, yeah? So the first thing they do on a cruise is they tell you go to your mustard station and you put on your vest, and that's where you're going to go to die, okay? So therefore, they start off with that, And then right afterwards, they say, go to the buffet, enjoy yourself, okay? They don't focus on the dying part. They say, go eat and have fun. So we need to focus on the good part, that we can do good things for you. So therefore, the interest and desire is prevention and protection. And so it's a hopeful message that we're actually giving out to people. And it's for you, and more powerfully, it's for someone that you care about. So in other words, we might not access the patient, but we can access their loved ones, their children, their spouse, their, whatever. And then that way they will make sure that they get the testing done, et cetera, okay? What about action? What would you like them to do? What is the action that you would actually like them to do? Very simply, we would like you to do your testing, tracking, and treating. That's the part that we want people to actually get involved in. And so what will you do? You will do a test, which is the EGFR, urine albumin-creatinine ratio. You're going to track it, test every so many, and that KDIGO heat map will tell you how often. And then finally, treat. So we've got RAS inhibitor, SGLT2, blood pressure control, glucose. So there's a lot of things that we can do in order to protect your kidneys and to keep you very healthy. When we started off with motor cars, we had to tell people to test for their oil, right? So people, remember, you had to pull out the thing and test for oil. And so we told you what the oil looked like. This is when you have to get an oil change and all that kind of stuff. So the same thing here. We just have to do things. So this is nephrology in one slide, okay? So blood goes in and pee comes out. This is a perfect slide for nephrology. So therefore, we need to have two tests, right? We need to test your blood and we need to test your urine, okay? So therefore, we're going to do an EGFR test and we're going to do a urine albumin-creatinine ratio test. So that's why we have two tests to check for it. And what are those two tests doing? The EGFR is looking at speed of filtration. How fast is your kidneys working? So therefore, we would like to see it at least more than 60 miles an hour. And I tell patients that. We want it more than 60 miles an hour, and you are sitting at 30 miles an hour. Now, immediately, any patient will know that that's not good and that they're at half function. So I don't have to explain a whole lot of stuff. We had that one question, how do you explain it to patients? This is how you explain it to patients. And they now understand what EGFR means, and up is good, down is bad, et cetera, et cetera. So therefore, the KDIGO guidelines becomes very easy. We say, okay, here's your EGFR going down, and so therefore, as it goes down, it's worse. So therefore, very simple for people to understand. Number two, albumin-creatinine ratio is harder, so I had to think about this one. This is the quality of your filter. How good is your filter? Can your filter keep the good stuff in and then get rid of the bad stuff? So what are we going to decide is the good stuff? The good stuff we're going to say is albumin. Protein is good. We don't want to lose that. And the bad stuff is going to be waste product. What waste product? Creatinine is breakdown of muscle. So therefore, that'll be our waste. So a perfect kidney would just get rid of waste, and that's it. So if you're going to measure the albumin-creatinine ratio, albumin on top is going to be 0 divided by a number, so then it's going to be close to 0. So therefore, a low number means that you have a good quality filter. On the other hand, if you're releasing a lot of albumin, then when you do the albumin-creatinine ratio, you get a big number at the top, and so the number goes up. So a high number in this situation means that your kidneys are leaky. And so patients can understand that as well, not complicated. And therefore, we need to measure two things, the speed of your kidney and the quality of your filter. And so that's why we put it across this way as the quality of the filtration going this way and going this way is bad. So now we could put the two things together and then say down this way is your EGFR and down this way is the quality of the filtration. So that's why we could fill this map in. So now we've got EGFR, speed, and we got albumin-creatinine ratio, which is quality, and you need both numbers to figure out how things are going. Not complicated. I just did that in less than 60 seconds. You can do it quicker in your native language as well. And that predicts all sorts of stuff because your kidney is a big blood vessel, so it predicts cardiovascular disease. So if your kidneys are bad, your blood vessels are bad, therefore your risk of cardiovascular and kidney disease is much higher. Protection, so what should we give? Who's the Iron Man here? So we've got blood pressure control, right? Who's Spider-Man? He's got glucose control, that's good. How about Superman? That'll be RASI. And then how about Wonder Woman? That'll be SGLT2 inhibitors. So we have a lot of people fighting on your side, right? So therefore, the more we get you in on this, the better it is. And then this is the Disney picture, okay? So what is the final story that we're talking about? We're talking about no symptoms, right? This thing will keep working, so you have to go check on it. And we want to prevent and protect, right? It's a positive message that we're trying to give. The people that are at risk, diabetes, high blood pressure, cardiovascular disease, family history, and the test is EGFR, albumin-creatinine ratio, so speed and quality. And then you're going to treat it by looking after blood pressure, glucose, RASI, and SGLT2. And guess what? This can all fit in a tweet, okay? So therefore, in Twitter, this would be good. It would fit in 140 characters, and you can send that out if you like, okay? And you could send the same message anywhere. See, it doesn't matter the medium, it's the storyline that's important, right? It's the messaging that's important as opposed to how you send it out. This could be on a bus stop, this could be anywhere, that same message would be useful. Do you need a lot of money to do this? The answer is no. It's very not complicated, right? We made it actually very, very, very simple. Now, it's very interesting. We can make it complicated, okay? So here's a cat, okay? And so basically, you remember the thing that Google did? What did Google do? Google went to go and see if their computer would recognize a cat, okay? So they made it really complicated. They had 16,000 computers linked together, and then they spent 3 days on YouTube looking at videos, and then finally, at the end of those 3 days, it was able to recognize a cat. Okay, so we could make it very complicated, whereas you and I can recognize this as a cat. I don't need the hairy picture, I don't need the 3D anything, a very simple line diagram, and you can recognize the cat. So I don't need a whole lot of detail to recognize chronic kidney disease. In fact, you could recognize movement with just a few simple lines. So in other words, let's not make it complicated that we need these superpower computers to be able to figure this out. However, everybody thinks that we need to move to a superpower computer. And if you look at this, the top 10 EMRs in the world, top 10 EMRs, the number one is the Epic system, right? People have heard about the Epic system. So let me talk to you about the Epic system. Now, if you add all those ones up, there's 6,528 EMRs out there installed with the top 10. So 6,500 EMRs sitting out there. And if you look at the number of hospitals just in these countries, look at the hospitals that are out there. 10,000 for Colombia, 8,000 for Japan, 6,000 for the United States, and there's only 6,500 EMRs out there. So if you think EMR is going to fix everything, most of the people don't have an EMR. So therefore, it's not going to fix the problem. By the time people have an EMR, most of your patients are dead from their kidney disease already. So we can't wait for the EMR. So let me just show you the Epic. My sister has multiple myeloma, and so therefore, she has all her blood tests sitting here. Now, because of her multiple myeloma, her kidneys are extremely at risk because of the drugs and also the protein that she's getting. So look at this. This is the same day blood tests, July 6, July 6, July 6, July 6, July 6. And you have to click through each one of them to look at the results. So nobody's going to do that. So what they did was they gave you little signals that these are important, right? These are the abnormal results with a little red exclamation mark. So which one will you click on? The red exclamation marks. You will not click on any of the other ones, okay? And look at this one. What are you not going to click on? Creatinine. So inside that creatinine is the EGFR. You will not click on the EGFR, and if her EGFR went from 90 to 62, it has not crossed below 62, it will not flag. So she could lose 30% renal function, it will not flag, the test was ordered, nobody looked at it. And that's the Epic system, the most used system in the world in every single hospital. And it's got a design flaw like that. Okay, nobody will click on it. What about here? Down on the summary here, you say, so plan of care. That's good, right? We're going to plan what she's going to have. Plan of care. Your care team has not set any goals for you. Okay, so that's a problem, right? Okay. What about this one? Trends dashboard. I said trends, right? That's the direction of creatinine and stuff like that. There's no information to display because nobody put it in. And what about this one? Advanced care planning. I thought that's good. Advanced care, kidney disease. There's no documentation. So this is about dying and stuff like that. So until you put something in, there's nothing there. And the doctors are too busy. They're not putting anything in. So we have a system that's not working, okay? Now, we have basically the Epic system is just your filing cabinet, but we've just made it into a digital version. It's not useful in the fashion that it is. So people said, okay, why don't we do ChatGPT? We'll just send it an artificial intelligence, and therefore it'll go in there and everything will be good. Unfortunately, you need to train it, otherwise it's no good. So basically what they did was there was a ChatGPT for dating. So you can actually, build a profile and date with this thing. And so what happened was that they did the dating, and this lady did the dating, and basically they said, for the first 3 days it was fantastic, very responsive, everything else. After the 7th day, the ChatGPT thing sent back saying, I'm very sorry, but I cheated on you. And she said, what? Because apparently this thing went out, and most of the conversations are about, I'm very sorry, I cheated on you. So it didn't know what that meant. It just took those conversations and then put it your way. What happens if it sees that in your whole hospital, the average EGFR is 45, and it says EGFR 45 is normal? Therefore, it won't report it back to you. So please don't send artificial intelligence without training it first to what to look for, okay? What about this? I was looking for a ticket to come here, right? It's a very expensive ticket. So anyway, if you notice here, it says price graph. They all have it, right? They show you the price of this thing going into the future. They can even predict the prices of the future. I don't want the future, I just want the past, right? So if I can have my EGFR and my urine albumin creatinine, first of all, I want it together, right, in the same spot as opposed to 15 pages later. And number two, just show me a graph. Is it going down? Is it going up? And if you can't graph because it's too complicated, can you show me an arrow up or down? That would be enough. Or if you can't show me an arrow, type me a plus or a minus. So in other words, if you just have a text printer, then just type me as plus or minus. So nothing complicated, but we can use this thing to our advantage. So you can see the cat sitting over here. We don't need a bunch of fancy stuff to actually do all these things. So if you are in a country where it's just paper version, it's okay, because you could do a good job. We do that with growth charts with children. So can we make it colorful, right? Because we have red sections for the bad sections for EGFR. It'll just be horizontal going across, and so on and so forth. So tomorrow, maybe we can work on something like this in that particular session. So it doesn't matter which system you're in. What we need to do is that Kaizen stuff, right? Remember the word Kaizen means change for good. In other words, constant improving. I don't care if you're on paper or an app or you're on an Epic system. I want you to improve that system. There's no need to cross systems. You just need to improve the system that you have. And that way you can protect people this year as opposed to waiting another 10 years before you get everybody digitized and everything else, because too many people will end up on dialysis in that particular time frame. So avoid this. So anybody that gives you a complicated solution to your problem is not the right solution. We want to do an Einstein, right? E equals mc squared. I don't know how you figured that out, but that was good. Okay, so we want to simplify things, not make things more complicated. Okay? Thanks very much for your time.